time for our panel of tobacco-free recovery, the community experts, perspectives from the field. We have a panel.
Great, so Cada Gonzalez, and then not sure if Katie Rogers is in yet. I know she'll speak later on, and Veronica Lewis as well will be on.
Let me just introduce you a little bit, Jessica. Jessica is our facilitator for this panel, and she's with the UCSF Smoking Cessation Leadership Center, and has been working in this field for several years. And she's the program manager for California Behavioral Health and Wellness Initiative. And so you can take it from there if you want to add a little something, and then it's your panel.
Sure. So just to give a little background, you've heard Catherine Safier present earlier. She's the Deputy Director of our organization, and I work very closely with her. We have been lucky enough to have a wonderful project, the California Behavioral Health and Wellness Initiative, where we've worked with many great folks who are addressing tobacco cessation in the behavioral health field. So we've got a few guests today. Arlene Vasquez of Cada, Cada Gonzalez of La Familia, and Veronica Lewis of the Homeless Outreach Program Integrated Care. And what should make this panel kind of interesting and dynamic is each of these folks are kind of in a different place in terms of the level to which they have or maybe haven't even addressed tobacco cessation in the work that they do. So we're hoping to have kind of an interactive, casual conversation where we can all kind of learn from each other as far as best practices. So what I wanted to do first was give each panel member a really quick, couple, 1 or 2 minutes, just to introduce yourself to folks, talk a little bit about the organization that you work with, and what your organization has done to address tobacco. And we can start with Veronica.
Good morning, everyone. Is it still morning? Yeah, good morning. Thank you, Jessica. And thank you, Norma, for the invitation. Veronica Lewis from HOPICS. We're known as HOPICS. We're part of a parent company called Special Service for Groups, and we're primarily based in South LA, Compton, and Linwood area. And we work in 3 different domains that obviously where smoking cessation is very much so needed. So we're a behavioral health provider, providing outpatient substance use disorder services, intensive outpatient, and recovery bridge housing, which is one of the main pieces I'll be lifting up as we talk today. And then we're also an outpatient mental health provider and one of just over a dozen trauma recovery centers funded by the state of California. We also, the second bucket of work is reentry. So an array of supports for people returning home from jail and prison, or folks that have been in the community for a while, but are still having difficulty stabilizing. And then the third bucket of work is our largest portfolio of homeless and housing support. So an array of services from outreach, access center, to a lot of permanent housing programs. But the thing I'll be talking most about today is our variety of interim housing programs, where on any given night, HOPICS, we're keeping about 2,400 people off the street every night temporarily in interim housing, including about 400 children. And there is a lot of smoking there. So we have not formally done any smoking cessation yet, but we are really excited about doing it because it is a major concern of ours, in particular at our recovery bridge housing sites. And as I mentioned, the interim housing program. So thanks again for having me.
Great, and we'd love to delve into that a little bit more. I know the homeless population, is especially underserved in this area. So I will be asking you a couple of more questions to address that. I'd love to move on to Arlene, get a little bit more information about Cada and who the clients you serve are.
Yes, good morning, everyone. My name is Arlene Vasquez. I'm the Director of Outreach and Community Engagement for Los Angeles Centers for Alcohol and Drug Abuse. Our acronym and what we're mostly known as is Cada. We're a nonprofit agency that specializes in behavioral health. We're on our 51st year responding to the needs of the communities. And our primary focus is on saving lives. The way that we do this is by providing direct services such as substance use disorder treatment at a residential treatment setting, outpatient setting, intensive outpatient settings, We have recovery bridge housing. We have specialized services that, such as medication-assisted treatment, HIV prevention, testing, and linking to care. We have homeless outreach and engagement. We're part of a mobile crisis response team that corresponds with law enforcement and fire department. We also have a youth and family services that focuses on our adolescents and transitional age youth and extending the support and services to families. We also are the largest provider for recovery bridge houses in Los Angeles County. As part of our contracted services, we've implemented smoking cessation throughout our services, making sure that we screen individuals upon intake and letting them know that we offer smoking cessation services that also include medication-assisted treatment for where we offer the nicotine replacement therapy. So it's great to be here today to be able to share our experience as far as implementing smoking cessation, being able to successfully have one program become tobacco-free, and then another where we had to implement a harm reduction approach. But thank you, Jessica, for inviting me.
Thank you so much, Arlene, for joining us.
You're
And I know we don't have you on screen, but just checking in, Auda, if you are able to access your audio and give us a little bit of update about your work. Okay. So
hi, everyone. I have a PowerPoint. Is that okay or no? Can you
Sure.
hear me?
Do you want to just give a quick, maybe 1 to 2 minute update on, what La Familia is working on, just to start with?
Yes, that would be great. Give me 1 second. Hi, everyone. So my name is Aura, and thank you, Jessica, and everyone at UCSF and Norma for having me here today. And I work at La Familia in Oakland, based in Oakland, California. We started with UCSF at El Chante, and El Chante was funded in the 1950s. It's a 90-day program. We house 20 mailmen. It's the only bilingual program in Alameda County, and we're proudly smoke-free since May 2021. So before El Chante became smoke-free, we had 6 fresh air breaks where clients were allowed to walk to the corner and smoke. They were able to have on them cigarettes, vapes, and chewing tobacco. So in 2021, we partnered with UCSF for the tobacco cessation grant, and we started working with them. We did many trainings, and one of our partners here in Alameda County grant us a scholarship to do a to become tobacco treatment specialist with the University of Massachusetts. And the majority of the staff took this training, and we're just waiting for it to be certified with them. The most important thing that we did was that we replaced the fresh air breaks. And we did that with walks around the lake, a lake that's near our home. We did gardening, movies, sports, tournaments, art hours, puzzle races. We did a lot of educations and groups around smoking cessation. We had a workout group. We included a healthy menu, and clients were provided with books, puzzles, coloring books, word search books, etc. We also have nicotine gum on site and patches for the clients when they need. Here's some of the gardening. They grow squash, tomatoes, peppers, beans. These are some of the activities. The beach, we went to the beach, we went to the movies. They did a lot of murals around the house and a lot of artwork that they were able to take home or donate to the house. And we just have it all around our house. This is some of the art stuff that they created while we were doing this grant, and they're still doing it. And I started something called the Tea Time, and I like to honor my grandmother because, so I'm from Guatemala and we are from Mayan descent. My grandmother was from a place called Cobana, Alta Verapaz, Guatemala, and she was very holistic, believed in tea cured everything. And so I did notice that some of the clients were still showing signs of anxiety, although they were taking medication and they were unable to sleep. So I just practiced what I learned at home when I was a child, and we would form a circle and have tea. And then I found all kinds of teas, you know, so so some of the benefits that we have found is that the clients reported, and we noticed that they had less anxiety. They reported that they were able to sleep better, and they started coming to our office asking for tea because they wanted to switch from caffeine to tea on their own. And they were optimistic. They're actually optimistic. They look forward to tea time every night. And we found it a way to kind of nourish them. And, you know, we can't go back in time to like nourish them as their mother, but that tea time kind of like it's right before bedtime, and they feel loved, and it's helping them with their tobacco cessation. So thank you, and thank you for letting me share.
Sure. Thank you so much, Ada. I appreciate that explanation. That's wonderful. One of the things that I wanted to start with was an issue that came up a little bit earlier in these presentations, which is the issue of health equity. And I would love to understand a little bit more about how folks, maybe we can start with Veronica, would look at something like tobacco cessation as an issue of health equity.
Thanks, Jessica. Yeah, and unfortunately, I wasn't able to be a part of the earlier discussions, but I, you know, as a homeless service provider, we're one of the largest homeless service providers in Los Angeles County, serving some of the most disenfranchised and impoverished communities with all the different health disparities and overrepresentations and essentially very disturbing data in all facets of life, right, including health. And one of the things I find most interesting is, you know, in the homeless services sector, there's been a lot of work and we're still not where we need to be, but you know, there's a lot of attention paid for obvious reasons to the intersection of behavioral health and homeless services, and in some cases lightly touching, you know, in particular related to STDs and STIs, some of the preventative stuff. But there is not any focus on smoking cessation. And as I've said, are a significant amount of people that are living outdoors still, or even in our shelters who are smoking. And so I think that it's critically important that we begin to really focus on the dangers and the impacts of long-term use of tobacco amongst our homeless service. Amongst people that are experiencing homelessness. And so I think that, you know, it falls into the larger equity push related to trying to address all the different disparities and the overrepresentation in chronic diseases and early deaths and all these other things that I don't have to tell this group about. So yeah, it's critically important. And that's why I'm glad to be here today to maybe push for that as one of the leading organizations in our system, so it can be a system-wide effort.
Great. That's really helpful. And, you know, I know we're always trying to tie this into what we've heard earlier. And one thing that people brought up is, you know, what I like to think are myths that maybe folks who are really struggling aren't interested in quitting, or, you know, staff members at organizations feel like, you know, hey, folks are dealing with homelessness or they're dealing with drug addiction, you know, let's put tobacco use on the back burner. So I know, Arlene, you guys were able to kind of address tobacco really on par with a lot of other issues. And I'd like to hear a little bit about, you know, the way that you went about it.
Right, definitely. One thing that resonates as far as tobacco is I had one of the coordinators say, oh, Arlene, we're finally addressing tobacco use as a disorder, right? And we're putting tobacco as a substance that needs to be addressed. So working with vulnerable populations, earlier we heard about the adverse childhood, you know, experiences, ACEs. A lot of the individuals that we provide services to are community that we're surrounded with. There's history of trauma. So therefore, you know, there's also the diagnosed STDs and co-occurring disorders. So we're seeing how tobacco use impacts this particular population and the inequities that exist. So what we're doing is, as an agency, filling the gaps to educate the individuals, empower them so that they can make educated decisions. So just like earlier, you know, throughout the conversations and the education that we received, Rather than telling the individuals what they cannot do, let's go ahead and introduce them to alternatives that they can do. And especially with the tobacco industry focusing particular populations such as our youth, right? We make sure that we also provide a lot of prevention education so that there isn't misuse of substances, including tobacco and nicotine. So that's how we're addressing the inequities, right? And making sure that there is health equity through education, not only through the direct services that we provide, but also through community engagement and education, and along with our county, our state, and our federal government, working on policies and addressing this as well.
That's wonderful. Thank you. So, we've talked a little bit about health equity, issues that folks in the community are facing and how that works together with enabling them to have access to tobacco cessation and how important that is. One of the things I want to address, I know Catherine was talking a little bit earlier about, unfortunately, the lack of organizations that have gone tobacco free and how complicated that can be when you've got staff who are smoking and they get along well with the clients. You're sort of sending these mixed messages. So I wanted to ask Aura briefly. You do have an organization, La Familia, that was able to go tobacco free, and I wanted to just pick your brain and ask a little bit about how you were able to do that and how you worked with the staff.
So we were able to do that. We did a lot of education. We did a lot of webinars like this one. And at the beginning, we didn't have a lot of knowledge about, how tobacco was affecting our clients. We actually felt like, oh, if they're feeling anxious, let's give them an extra smoke break so that they can relax. And we didn't realize how we were harming them. And so we did a lot of webinars, we did a lot of education. I'm grateful that we partner with a lot of, for example, the Bridge Clinic at Highland Hospital, Lifelong Medical Center, who gave us a scholarship to do this TTS training. And, everybody, all the providers around here that were happy that we were going smoke free. So they gave us curriculums, they gave us ideas on how to what to do with the clients. And there, I would say maybe about 20% of the clients report that once they're done with our program, they're going to go back and smoke. But I was surprised to see that the majority of the clients are they say how stop smoking has bettered their lives, and that they're gonna continue with their recovery and stop smoking. They definitely enjoy the art groups. They enjoy the gardening. They worry about their fruits and vegetables and worry about how long it's going to take for it to sprout. So, we are available for them 24 hours. So if they're going through anxiety or they feel like, I need to talk to someone about, I'm having cravings for cigarette, we were always available for them. And it was very surprising to see that they themselves reported that, even the tea there, you would see all these guys with tats in their face and they would look at the cup and they said, I didn't know tea could do this for me. So I think those were some of the factors that help, and meeting monthly with UCSF, Christine, that really helped us be successful with this. In early intervention.
I think it's very important that you talk about not making assumptions. I mean, in our program, we've seen, like you said, kind of men with a lot of tattoos who are in prison and they're doing trauma-informed yoga and they're loving it. So I think it's awesome not to put the kibosh on anything before trying. I think that's a big deal, to kind of try and see what works. And one thing I wanted to ask Arlene, I know you guys did a lot of amazing work in terms of doing some reframing. So not focusing simply on, okay, you guys are not smoking, but looking at how can we sort of create an overall lens of wellness and get people to kind of change their lives and focus more on health. So if you wouldn't mind talking maybe a little bit about some of the things that you were able to accomplish.
Sure. So you'll probably hear some commonalities along with what Auda just presented. It was about helping the individual just take a holistic, whole person approach, right? Don't see this as, we're offering you smoking cessation or we want you to quit completely. It's more of an opportunity of how can we guide you or assist you in improving your overall health. One way to do that is by addressing nutrition, right? So rather than just presenting nutrition, we made it more of a inclusivity, right? Taking all the diverse cultures and sharing with one another, putting some of those healthful dishes on the menu. So incorporating their culture, their healthful meals into our menu and empowering them to be a part of that design. Another way was to help the individuals ground themselves with nature. And that was through walks, through gardening, through exercise, outdoor exercise. We also use very affirming words, right? And to destigmatize a lot of what's associated with tobacco use, right? So rather than say it, you're going to have a smoking break, it's like, let's have a wellness break, or give them alternatives, something available for them to pick up instead of picking up a cigarette. We use the rethink your drink, having infused water available for them when they have that oral fixation. Also through therapeutic services, right? Empowering individuals to have, sometimes it's really difficult for individuals to express themselves vocally, verbally, right? But throughout, it's amazing. All these individuals just become these expressive, amazing artists where they put together beautiful pieces of their experiences of how they associate the tobacco use and incorporate it into how it's affected them negatively in their lives, or the big picture as far as how they see their health being improved overall. So that's the approach that we take. And at one of our programs, we had to take a harm reduction approach, right? Where we meet the individual where they're at and making sure that it's a person-centered approach, that we educate them, that we support them, and through a treatment approach, give them the resources that are available to them for them to access. And it's always, it's the opportunity to connect with these individuals, give them the skills to be able to use in the future. And I always tell them, we equip you with the tools that you'll need to make better decisions, but it's ultimately up to you to make that decision. So that's how we incorporated the overall wellness with exercise, we bought equipment, having it available for them outdoors. We also purchased a grill so that we could do more outdoor grilling, utilize the citrus fruits that were growing on the property, pulling those natural herbs that they're growing in their herb garden to season a lot of the food. So it was just a matter of, we offer the residential treatment services in the least restrictive environment, and teaching them that when they transition back into the community, all the lived skill set that we introduce them to or just reinforce can easily be transferred once they go back into the community. So that was our approach, and it gave us a great opportunity to really connect with the patients and have our smoking cessation groups, process. Our clinician was the one that would host the groups and really empower the individuals to make those changes.
Great, that's wonderful. I know our time is running a little bit short, but just wanted to put that out there. I know formerly the California Smokers Helpline has become Ticket California, and I'm curious with Arlene and Auda, I know it can be really challenging. Oftentimes agencies do not have enough staff sometimes to really run every program you'd like to run. I'm curious to hear from either of you if you were able to utilize Ticket California services, or I know Auda, you spoke a little bit of some of the community partners. So we might want to give folks here a little idea of who's able to really help out in this situation.
Sure. So we utilize, the hotline, right? The Ticket California. We've had their director provide education to personnel. It's easily accessible. They have they have apps. They have the nicotine replacement therapy available to the individual. They have support calls. But not only are we able to utilize their services, but we also have our medication assisted treatment on site. So, internally, we just happen to have a department that offers that, and we include nicotine replacement therapy. But KK California has been a great partner. Their director is always open to providing education. No issue with accessing the hotline at all.
Great. And Auda, could you just chime in as well?
Yes, so La Familia has many programs, is very rich in resources. And we actually have a program called Basta. And so they are, it's a program that educates different programs on how to use Kick It California. So definitely we took advantage of that resource. And we partnered with our local hospital and their bridge, it's called the Bridge Clinic, and they do mat services. So, as if we did early, almost as soon as they walked in the door, we did an assessment. We talked to them about this is a smoke-free place, and then we would educate the client about mat services and the NRTs, and some of them were open to it. Also, we were also educated on how to chew the gum properly. So that was a lot of success because they didn't know how to. And so that when we would teach them, that was something that they, that it started to work for them, and instead of rejecting the NRT. So like I've shared, we did a lot of partnerships with medical centers like Lifelong, the Bridge Clinic with Highland Hospital, in our own agency with the Basta program for Alameda County.
Great, that's a really good help. I want to thank you guys so much for the wonderful work that you are doing. You're all in different stages of this process and have a lot to add. I just wanted to mention briefly, we will make available our toolkit for cessation and taking organizations tobacco-free. So, feel free to follow up with myself or Catherine. We're happy to talk with anybody who is interested in starting this process and maybe unsure of how to go forward. We've got some great steps for you to follow. It's not an easy process, but it can definitely be done. So I think our guest speaker hasn't quite joined, but maybe I'll have folks round it out.
I'm sorry.
Veronica.
I'm sorry. Catherine asked if we could address, let me roll back to it. If possibly Arlene and Auda can share how they utilize the Office of Problem Gambling and Nutrition Education, Obesity, and Prevention Services to strengthen their wellness activities and help sustain their cessation efforts.
So definitely, part of the partnerships and the connections that we made through this particular program was with the Office of Problem Gambling. And we're like, what does this have to do with smoking cessation, right? And then we blew out the candle and turned on the light bulb. I was like, oh, smoking is always allowed at the casinos, one thing, right? Two is, gambling is an addiction. And so we were able to provide that education to the individuals as well. Use a screening tool to not only, screen for substance use disorders, but also for gambling addiction, right? And address that with the individuals as well. As far as the nutrition, education, abuse, and prevention services, once again, it was just about, having health, more of a healthful proportion as far as foods were concerned, incorporating more natural foods such as raw vegetables, fruits, lean proteins, more exercise, and making sure that the individuals are educated to be able to make better choices.
Great. I like how you talked about that, Arlene, in terms of things being a holistic process. So, while we might want to go tunnel vision and really focus on the cessation piece, I think there are so many other linkages. And I know the work that you are doing is amazing, and I hope to hear about the work that you will be doing, Veronica. I know you have a population that definitely has a lot of their own struggles, but being able to address this, I think, will make a huge difference in terms of people's overall health and well-being. So I see we're, I think, just about wrapping up, but it does look like we have one more question from the audience, and
Yes.
they want to know how to ensure that harm reduction work also includes the provision of NRT. I know sometimes that has been an issue for folks who are working on this, not knowing how to provide that in their budget. But maybe if Cada, you can speak really briefly to NRT in your program.
Yes, so our agency they help us purchase a nicotine gum that we have available for the clients. And I partner with Lifelong Medical Center also, and I applied for, they gifted us a bunch of NRT for all of our programs, not just El Chante, for our outpatient and our youth program. So, you know, I guess just hearing opportunities and talking to them often, they tell me of the different opportunities there is to get NRT. And also the Bridge Clinic, being able to enroll our clients in Medi-Cal fast, and applying for, Alameda County has medical insurance for undocumented participants. It's called Health Pack. And so being able to enroll them probably on their first day, we're able to get those medications for them when they're prescribed by their doctor. And using GoodRx also. So we try to use all of our resources available for our clients.
Great. So I think just I know we're running short on time, but to wrap it up, what I hear from everybody, from Veronica, Arlene, as well as Cada, are kind of three main pieces or takeaways. I think one of them is really looking at the issue of health equity, making sure that we are meeting people where they're at and offering them appropriate services. Education is a huge key. A lot of people don't necessarily know what we know, don't know about the harms of smoking, or don't understand how it's important in the scheme of dealing with other addictions. So I would say that was a big piece. And the last thing I would say is really making sure you take advantage of your partnerships. So I would have just talked really about, you know, grant opportunities, about how to purchase NRT. We've worked with organizations that have, you know, gotten gym equipment donated or any kind of thing. So reach out into your community. It's ripe with opportunity. You guys have some great connections. Make sure to utilize those connections. So those would be my parting words. Thank you so much, Norma, and thank you to everybody on the panel. This was a really rich discussion.
Thank you, panel. I'm a little biased. I'm from the community, and I always love this panel, getting the information from the, you know, folks with the boots on the ground. We are really interested and appreciative of all the research information that we get, and this piece is really important to folks who want to implement what the researchers have told us works. And thank you for taking the time. I know y'all busy out there in the real world, so thanks again.